Welcome to Akhand Yoga, the first institute of impeccable wisdom, the walking, talking encyclopedia. Bradycardia, the reduced human heart rate. My dharma, the impeccable wisdom, the wisdom of every perfect object of the universe. My greatest discovery, Divyank, the divine design of nature, with which every perfect object is designed and created. Divyang is the reward of 60 years of integrated education. Impeccable wisdom is enlightening. Akhand Vidya wisdom is empowering. To understand bradycardia, which means reduced heart rate, and I have already explained tachycardia, which is increased heart rate. And I made it very clear, increased heart rate, one of the reasons is Kundalini syndrome, which is sympathetic, mimetic, hormone imbalance or increase. On the other side, bradycardia, reduced heart rate, could be from the angle of sympathetic, dystrophic, cranial parasympathetic or vagus. Let me be very clear, it is a vagus, not anything else. From that angle, now let's understand how bradycardia happens, which is efficient, effective, reduced heart rate, but within the physiological limits, which can help us to live much better life than increased heart rate or Kundalini syndrome or the fluctuating mind. This is the objective of this particular video to understand. Now to understand this particular slide, which is called the perfect human heart anatomy, the 4 chambers and 4 valves, the size and shape is Divyank ratio. This is something which I have already explained. If you look at the heart, the width and the height is in Divyank ratio, that means into 3 into 5. It is not by coincidence, looks like a fist, exactly like a fist, and that's it. Now, I also would like to revise again so that people understand how beautiful is the heart. 100 trillion cells use oxygen absorbed from the atmosphere and glucose taken from the gastrointestinal system along with water, electrolytes, etc. All these tissues circulation takes place in the 100 trillion cells. As a result, carbon dioxide and water are produced. Water is used inside the body, whereas carbon dioxide has to be thrown out when it reaches a particular level of concentration. But how does it reach lungs and for expulsion, and how oxygen is in? Before that, let's understand the whole system very well. 100 trillion cells produce carbon dioxide, and this blood, carrying deoxygenated blood, is carried through inferior vena cava from the lower body and superior vena cava from the head and face to the right atrium, as you can see, blue color. From right atrium, the blood through tricuspid valve reaches the right ventricle, and from right ventricle it goes to pulmonary semilunar valve, to the pulmonary artery, to the pulmonary arterioles, into the lungs, where oxygen is absorbed from the atmosphere. Atmospheric pressure at sea level is 160 millimeter, where alveolar level is 100. That ratio is also Divyank ratio. And it comes down to 38.2 at a vascular level is also reality. Having absorbed oxygen, that blue blood is becoming red, as you can see right down, through the pulmonary vein to the left atrium, through tricuspid valve or mitral valve to the left ventricle, then semilunar valve to aorta, and through artery, arteriole, systemic circulation to the cells of the entire body, and this cycle goes on, goes on, goes on. Each cycle is called cardiac cycle. There are approximately 72 cycles or 0.8 milliseconds per beat is a cardiac cycle. So I'm sure you understand. Let's understand the very next slide, which explains it. This is perfect human cardiac cycle. As I told you, if it is normal 72, it will be 0.8 seconds. In atrial contraction will be 0.1 second. Atrial diastole is 0.7, and this ratio is like Earth, which is made of 7 parts. It is like a reservoir, where the ventricles work as a pump. It has got full contraction and dilatation. Even atrials have a contraction of 0.1 second, and dilatation of 0.7 seconds. But here ventricle systole is 0.3 seconds and diastole is 0.5 seconds. This is the ratio which is maintained here. And this ratio is Deviank ratio. So from that angle, heart not only structure, shape, even functions in Deviank ratio. I've also told you ECG is the most important part, easiest of all the things to understand, and this L to lead, this particular shape, P, Q, R, S, T, U, in this particular shape has to be maintained throughout life. If you can maintain, you are perfectly fine. But this is for 72. It can be brought down to 60. Although bradycardia, anything below 60. But let me put around 60 as an ideal thing to be maintained when you are at rest. But let me call that as a reduced heart rate as a bradycardia itself. But if it is even lower than that, can be done, because all the good athletes, sports people who are not at all disturbed in mind, have a complete control over the mind and know things very clearly, their basic heart rate even during excitement will come down. But rate could increase with excitement and many physiological reasons. Also something which I've been saying again and again, please keep it in mind before you take a decision how to come to a conclusion about arterial blood pressure. Normal 120 by 74 millimeter. If you can maintain that, you are the happiest lot, and you can make the pulse 72 and bring it down to 60 as a basic. Even little lower than that, you are even better than that, because blood circulation to left ventricle of the heart is through diastolic stage, and in ventricular diastole it is the diastolic stage which is reduced, not the systolic. But in relaxation, both the ratio of systolic and diastolic are maintained in the same way. I won't even be surprised if the ratio of ventricular diastole is even slightly better. But let's presume this Deviank, leave it at that. From that angle, that will, as a result, left ventricle will get more blood during diastolic phase than during systolic phase. This is the reason why I'm showing this again and again, to emphasize why Deviank plays a very important role to maintain heart rate, cardiac output, cardiac cycle, all the parameters within physiological limits. And over, I want everybody to keep their heart rate as effective, as consistent, as lower as possible, but within physiological limits, not go to the stage that you have a problem. Now from that angle, let's move on to the next stage. Now I have put two hearts down. On top I have written the autonomic nervous system. That means both the hearts right up to fourth stage of nervous system is controlled by autonomic nervous system. That means sympathetic and parasympathetic. Parasympathetic is by the cranial parasympathetic vagus nerve, and sympathetic is from upper inferior cervical ganglia. Now let's not go into the sympathetic at all. Let's focus on to parasympathetic. If your heart rate is going to be reduced, pulse rate is going to be less than 60, this cardiac cycle of the heart, which is made of 10 parts, in tachycardia, the same concentration is continued, systolic remains same, diastolic is reduced, but in bradycardia, this selected system, can you observe the difference between left picture and the right picture? I'm sure you are, but if you are not, let me explain. Now in a normal 72 heart rate, you can see SA node placed on the left side, right on top. Then you have three articular things right in the right ventricle, which bring the concentration up to AV node. Then bundle of his and through the distribution to the rest of the body. And also one branch from SA node goes to the left atrium and supplies that. This is a normal structure in which when SA node is stimulated by returning venous pressure of superior vena cava and inferior vena cava is the stimulus for it. It's not anything else. that is also a point which I'm again and again repeating it. Stimulus for SA node is the venous pressure. So in case of failure, lift the legs, let the venous return come to heart and increase the pressure and thereby stimulate SA node by itself and regenerate the cycle of 72. So I'm sure you can see very clear idea of 10 parts. SA node, 3 arterial branches, AV node, bundle of his, and left branch, right branch, and further branches are the 10 parts, which are very, very clear. Hope you have understood. This is the perfect structure of 10 stages of conducting system of the heart. But in case of bradycardia, when concentration comes down, stimulus is done to the SA node, you can see on the left side. Now highlight, you can see out of 3 of the branches in the right atrium, the conduction is only through one of the middle arch to AV node. Other 2 arches are not very prominent. At the same time, SA node conduction is conducted to the left atrium, also independent. So left atrium is independent, right atrium is independent. From there the concentration going to AV node is also independent. And then bundle of his, then the branches, and how the distribution takes place. Because the concentration is not through the 2 other articles, stimulus of the AV node is less. At this juncture, I would like to repeat one of the slides which I made earlier. Is suppose you ligate stimulus to SA node, and normal, if it is 72, heart rate would increase to 100. That is the first thing which takes place when it is below the level of stimulus from sympathetic and parasympathetic to SA node. Lesion is above SA node, heart rate will increase. But if it is a SA node, heart rate will reduce it. Then when come to AV node, reduce will come further. When bundle of his, radiation will become. And when ventricle escape, the heart rate could come down to as little as 25 to 30 to 35, and is called ventricle systole. So come what may, this whole system is designed in this way. Even if you have a problem with nervous system, you have a problem with autonomic nervous system, you have a problem with sympathetic system, you have a problem with parasympathetic system, in spite of all that in unconscious state, SA node can still function as long as blood is circulating within the body, and venous pressure can make sure this particular activity is going up. So from this angle, this particular stage is very clear. In Kundalini syndrome, where this excitation of the sympathetic system, heart rate will go over 100. It can go further. And there are also the stages like physical exertion, stimulus, local stimulus, mental stimulus, pressure stimulus. And all these things can increase the heart rate. There can be also many tension, anxiety, neurosis syndromes which are associated with high. But when the mind is normal, we are not fluctuating, your blood pressure is normal, blood volume is normal, cardiac output is normal, end diastolic volume is 120 ml of blood, ejection fraction is 61.8, and your heart rate is normal, then things will be perfectly normal. Only when reduction comes beyond to much lower level, then the heart rate can come down, and that is the objective with which I am showing about bradycardia selected system. And as a result, heart rate is, as long as this conducting system is normal, blood pressure is normal, blood volume is normal, cardiac output is normal, and person is physically very active, physically, psychologically normal, mentally alert, spiritually integrated, lower heart rate because of pranayama or other exercises, which is beneficial whatsoever. From that angle, person would function much better during aerobic exercises as well as anaerobic exercises, and almost every condition heart rate kept low is very, very beneficial, and keeping it to 60 at resting rate would be phenomenal. So from that angle, now let's move on to the next stage, which we can see. As you see in this particular picture, I have shown autonomic nervous system. You have on the left side, you have a sympathetic system, and right side, you have a parasympathetic system. Anatomy-wise, the cranial parasympathetic, there are 4 pairs of cranial nerves. Third cranial nerve is oculomotor. Seventh is facial. Ninth is glossopharyngeal. 10th is vagus. All the 4 of the 12 pairs are parasympathetic in nature. Then you have a sympathetic system which originates from spinal segment 14. Spinal nerves are 28. 2 vertebral chains have got 45 and prevertebral 5, and that ratio is deviant. Then you also have a sacral parasympathetic right at the bottom, which is made of S2, ST3 segments and distribute 5 organs, is also in deviant ratio. On the right side, you can see the parasympathetic. Vagus is the one which is responsible for reducing the heart rate and is also vagotomy. When person is more into vagus, more parasympathetic, without any tension, anxiety, neurosis, physically he is healthy, emotionally stable, mentally is powerful, mind is not working, and his mind knows A to Z completely, is not disturbed with anything. That person would have a vagotomy and heart rate less, which is beneficial as long as blood pressure is normal, cardiac output is normal, cardiac cycle is normal, and all the parameters are normal. From that point of view, the predominance of vagus nerve is important. Having understood the autonomic nervous system, sympathetic, parasympathetic, and concentration, from that angle, now we can go to the next stage and see how we can explain things even better. This picture is the last picture. We do have little time, so I can explain. Heart is associated with Anahata Chakra, which is the 5th center from Mooladhara. Lowest most chakra is Mooladhara, then Swadhisthana is sexual chakra, then Manipura or Navi, then Usha, and then Anahata. Anahata is associated with cardiac plexus, is also a vagus nerve, and also with mind, is also with mantras in other things. Now, to bring bradycardia, a reduced heart rate, and make us perfectly fine, let's now talk of Tantra Vidya as of experience, and I find if we are exercising regularly, getting early in the morning, having no disturbance of the mind, not taking drugs, not taking alcohol, not taking anything which can be unnecessarily stimulating and creating a problem, you can be in vagus nerve, vagotomy most of the time, very effective. But only way to get over all the problem, in my opinion, enlightenment plays very important, and enlightenment means integrated knowledge, Akhand Vidya. That means all the 64 arts, almost all the questions, you have all the answers. When you have all the perfect answers and your lifestyle from atomic, elemental to molecular to compound to cellular life is perfect, mind is at rest, mind is vibrant, is tuned with universal consciousness, intelligence is very high, intuition is very high, consciously, superconscious, you are in tune with the universe. You can be in tune with the universe 24/7. And as a result, you can produce 8 hertz frequency with eyes open throughout the brain, with eyes open and eyes closed throughout the brain all the time. You are in tune with universal consciousness. As a result, intuition will come up. And such person with low blood pressure, low heart rate, perfect blood sugar, everything, and super conscious would be in a position to draw all the data, information, knowledge, and wisdom, and impeccable wisdom from Akash Kosh, which frequency is also 0.8, 0.73. And as a result, all the perfect knowledge, ultimate wisdom, omnipotent, omnipresent, omniscient, everything is at truth. Then with that background, with the knowledge of all wisdom we have collected over a period, if we can get the perfect knowledge, have the heart rate normal, have their blood pressure normal, and as a result, we can do wonders. If you want to go through the 10 stages of Akhand Vidya, one thing is very important. You got to be highly intelligent. You should be mentally mathematician of divine nature, which is written about Vedas and Upanishads. You should be in nature's divine design automatically. You should be aware of all the 10 stages of Akhand Yoga. You have the knowledge of being honest, non-violent, non-abusive, and you are living like a living God on the earth among the people, untouched by the vagaries of earth. And that is what moksha is, freedom from all the constraints and restraints of day-to-day life. If you want to be perfectly blissful for hundreds of years and still be very effective, never fall sick in physical health, mental evolution, mental disturb, emotional imbalance, or any problem, nothing on the earth can touch you, and you can be dynamic, even 100 plus, as vibrant as you are 21. If you can maintain that, that should be the objective of every human being. He is the one which is called physically healthy, emotionally stable, mentally very, very powerful, very intelligent, very intuitive. He has the answer to everything. A to Z of every aspect of human anatomy, physiology, biochemistry, psychology. Almost all the subjects we center on mathematics, physics, chemistry, medical sciences. All what we are made of, everything is known perfectly. That person would have no difficulty at all. And my objective is dedicating myself to do this is to become a living example, that I can be a living example, and I would continue to produce better and better results as I grow older and older. Even at this age, physiologically, psychologically, emotionally, mentally, I'm definitely 1,000 times better what I was expected in my contemporaries by and large. But at the same time, I'm able to produce a kind of results also which speaks volume. From that angle, this particular video of BRADYCARDIA makes a lot of sense to me, should make a lot of sense to everybody else. So hence, let me say it was wonderful sharing my experiences in totally integrated way in the light of Divyank, and mathematics is wonderful. So thank you very much. We look forward to the next video.